walking in, performing hand hygiene. Hello, my name is Mary. I'll be your nurse today. Can you verify your name and date of birth for me?
Bella Curry, 09-2604.
Okay, I'm going to go ahead and take a look at your wristband. Your name and date of birth are matching up. I'm going to provide patient privacy. Next, I'm just going to make sure that your feet are flat on the floor, you're sitting. So today I'm just going to go ahead and get your vital signs. It should only take about 5 minutes or so. Are you feeling okay with that?
Yep.
Okay, and then before we get started, do you have any contraindications in either of your arms, such as an IV, AV fistula, mastectomy, any IV grafts, or any other injuries? And then do you have a preference on your arm?
No.
Okay, I'll just take that left arm here and here. Make sure it's lined up. And then I'm going to feel for your brachial pulse. I want to inflate it until I don't feel it anymore. So I stopped feeling it around 160. I'm going to wait 30 seconds and I'm going to add 30 to that. So next time I go, I'm going to inflate it to 190. Okay, I'm going to get your oxygen levels on that left index finger. Alright, and I'm going to, oxygen is at 100% room air. Get your temperature. There we go. Would you mind hitting that yellow button? Thank you. Alright, temperature is 98.5 degrees Fahrenheit on orally. Okay, I'm going to go ahead and check your radial pulse. Go ahead and rest that arm. Okay. Okay, respirations are 16 breaths per minute, and then that radial pulse, I got, let's do the math, 86. Yep. Okay, now I'm making sure that I pump this up to 190 this time. Okay, I got 122 over 80. Go ahead. There we go. And if you'll go ahead and take that chair and everything out of the way. Okay, now I'm going to enter this patient's room. I'm going to make sure I go ahead and perform hand hygiene. Thanks, Bella. Provide patient privacy. Hello, my name is Mary. I'll be your nurse today. Can you verify your name and date of birth for me? Okay, up there it looks like your name's Pat. On here I see Pat Johnson, account number, medical record number Date of birth 9/23/1969. Everything is matching up. Before we get started, do you have any known allergies? She doesn't know. On her wristband, it says she has a morphine allergy, so we will keep that in mind. And then, what is your diet? It looks like nothing by mouth, and I also note a feeding tube in the right nair. I'm also going to make sure the bed is at a working height. This works for me. I'm just going to leave it at this height with rails up. I'm going to perform hand hygiene and put on gloves before assessing that feeding tube. Okay, feeding tube is in the right nair. I don't see any centimeters, but there is some dark Sharpie lines to mark like the depth. It's not attached to her face at all. It's not secure. It looks like it is a little bit underneath her, so I'm gonna reach around. Okay, it appears to be a Salem Sump feeding tube, not connected, and I don't see any French marks as far as how big it is. The area where it's inserted, I don't see any erythema. Is there any pain around your feeding tube? Okay, she verbalized there's not, so I'm gonna go ahead and take these gloves off. Perform hand hygiene. Okay, now I'm just gonna go, before I even start my assessment at all, I wanna make sure that I inform Pat that I'm performing a metabolic, nutritional, and abdomen assessment. I'm also going to assess your skin as well, and that's only going to take us about 15 minutes or so. Okay, is that good with you? It is. So now I'm going to move to the hair. I want to make sure that the hair is covering the entirety of the head. It appears to be very consistent. Hair is brown, smooth, intact, no infestations noted. Now I'm going to go ahead and take a look at the mucous membranes of the mouth and nose area. Okay. Mucous membranes are pink, moist, intact. Now I'm just going to assess the nails. Okay. Nails are even, smooth, no irregularities noted. Cap refill is less than 3. Okay, I do see a wound on this right foot. We will get back to that. On this left foot, nails are smooth, no irregularities noted. Okay, I'm gonna go ahead and assess that foot at this time. Make sure I get these on. Okay. All right. Okay, so I see some necrotic tissue on the first, second, and third digit of the right foot. Surrounding the necrotic tissue, I see some erythema. So just to be a little bit more descriptive, on that first toe or first digit, I see erythema on the superior aspect of the digit, the distal aspect, and the medial aspect. I see erythema on the distal aspect of the second and third digits as well. Additionally, I see some erythema on the superior aspect of this third digit. And then I'm seeing erythema just around all the necrotic tissue places as well. Okay, so now I'm going to take these off and perform hand hygiene. And are you experiencing any pain in that right foot, Pat? No. Okay. Cover you back up. It's got a little bit twisted. Assess the rest of your skin. So it's looking like the chest area is warm, dry, intact. Moving down the arm, the outside and the inside of the arm is warm, dry, intact. I'm going to come back to that IV. Okay, I'm just going to lift your gown up a little bit, okay? Make sure I get the entirety of the chest area. Okay, it's warm, dry, intact. Abdomen, warm, dry, intact. I see no lesions or breakdown noted. I do see a catheter, so I will go ahead and address that. Make sure I'm performing hand hygiene. Put those gloves on again. Okay, so it looks like the catheter is inserted into the urethra of the vagina. Are you experiencing any pain around the catheter site? No. And I see no erythema around the insertion site either. It appears to be a 14th French. I see, okay, it looks like there's approximately 110 milliliters of bright yellow clear urine. It is attached to the right thigh. Okay, and then just assessing that skin around that area. It's warm, dry, intact. So now I'm gonna get rid of these gloves. Go ahead and perform hand hygiene. Okay, make sure not to touch that again. I'm gonna go ahead and pull this down since we've assessed that skin. Moving down this way, skin's warm, dry, intact. With the other side. Okay. Skin is warm, dry, intact. Warm, dry, intact. I'm gonna look at this left arm. Skin's warm, dry, intact on the outside and the inside. Okay, warm, dry, intact. Okay, so now can I get some assistance, please? I'm just going to assess the back pat, posterior. Okay, on 3, we'll just tilt towards you. 1, 2, 3. Okay, I'm looking at the back of the head, back, lower back, the buttocks area, the back of the legs, and any of those bony provinces, including the heels. Okay, so I am seeing what appears to be a, oh, if you'll keep them up, I'm going to go ahead and assess that right heel. Looks like there is a stage 2 pressure wound. I don't see any bone. Right heel looks completely warm, dry, and intact. No lesions or breakdown noted. Okay, yeah, so there's definitely some erythema around this wound. Skin is non-blanchable. Definitely appears to be a stage 2. Okay. You can go ahead and lower. Perform hand hygiene. Thank you.
You're welcome.
Okay. Now that I've assessed the entirety of the skin, most of the skin, I noted no lesions or breakdown, except for that right foot area, the heel, and that was it. Okay, so now I'm going to assess the skin turgor at the left clavicle. Immediate recoil noted. Now I'm going to, I've already voiced that there is the feeding tube in the right nair. There was no feeding tubes seen in the abdomen area. No GI, no GU tubes. So now I'm going to look at the tubes. It looks like there is an IV in Pat's right AC. I'm going to put gloves on to assess that area. And are you having any pain around the IV area? No pain? Okay, perfect. Okay, looks like this is a peripheral IV hooked up to 0.9% sodium chloride at 100 milliliters per hour. I do see a date on this. It looks like 9/15/24 on that peripheral IV. Looks like we're on it a little bit. There we go. Okay, there's no kinks noted. It's completely attached. It's intact, and the little sticker holding that in place is intact. No arrhythmia around the IV site is noted. The skin further around this IV site is warm, dry, and intact. You're not experiencing any pain? No. Okay, perfect. And there's that bad foot. Now at this point, I'm going to just ask you a couple questions. When was your last bowel movement and what did it look like? It looks like last bowel movement was Saturday. It was soft and formed. Okay. Are you experiencing any abdominal pain? Can you rate it for me 0 to 10? Pain is 0. Do you have any difficulty urinating? No. And have you been experiencing any nausea or vomiting? No. Okay. Now I'm going to assess the abdomen area. I'm just going to lift this up, okay? All right. Assessing the abdomen. Abdomen is symmetrical. No distension, pulsations, or masses noted. Skin color is consistent with the rest of the skin on the body. I'm also looking at the bladder area. No distensions, pulsations, or masses noted. Now I'm going to auscultate. I'm going to listen with the bell of my stethoscope at the epigastric area for 60 seconds. I'm listening for Brit. No Brit noted. Now I'm going to listen with the diaphragm of my stethoscope starting in the right lower quadrant, listening for 5 to 35 gurgles, which is normal active. I'm listening for 60 seconds in each quadrant. Okay, I'm gonna say she is normal active. I've heard 5 to 35 gurgles per minute, which is normal. Now I'm going to go ahead and perform light palpations 1 to 2 centimeters in each quadrant. Let me know if you're experiencing any pain during this time. No pain. I'm going to start deep palpations 3 to 6 centimeters in each quadrant. Any pain? No. Now I'm going to just assess the bladder area again. No pulsations, distension, or masses noted. Let me know if you're experiencing pain or tenderness. I'm going to lightly palpate 1 to 2 centimeters the bladder area. No pain noted. Okay, go ahead and put this down. All right, and are you in a comfortable position? You are. Okay, she's in a supine position, bed at 0 degrees. Here's that call light. Just call me if you need anything. Bed is low locked position with rails up. At this point, I think I have everything done. Can you tell me how much time I have left?
We have about 2.5 minutes left.
Okay. I'm just gonna run through it real quick. So here, mucous membranes, feeding tube, skin, fat. Okay, at this point, I'm going to foam out, and I'm done.